My name is Maria, and this video is meant to educate you on symptoms you may have experienced upon your initial mechanism of injury to your ACL, symptoms you may be currently experiencing continuing after the mechanism of injury, what you may go through during your examination, and what you can expect should you and your medical team decide upon surgery. Upon your mechanism of injury, you may have been making a quick turn, such as cutting or pivoting. This leads to ACL injury because as one part of your leg is continuing to move in one direction, the other is decelerating, which causes a miscommunication between the body. You may have also received a physical blow to your leg, forcing the body into a movement that the ACL cannot compensate for. You're still most likely having a hard time with walking or with side-to-side movements. When your knee initially twisted, you may have heard a pop of the ACL, but popping or clicking does not normally occur after the initial incident. You probably had swelling immediately following the injury or 2 to 3 hours after. This will persist and can be treated with ice, as swelling should be tamed before surgery is even initiated. Your knee most likely buckled on you or gave out during the time of your injury and is probably continuing to do so, especially with stairs, getting up from a seated position, moving side to side. You're going to continue to experience a lack of range of motion at the knee, weakness of your quadriceps muscle or the muscles that go to extend your knee, which is this motion, persisting swelling, especially after episodes when your knee is giving way. Each of these factors will most likely need to be addressed before surgery, probably with home exercise instead of physical therapy. Upon your initial PT appointment, you and your PT will check your flexion and extension of your knee with use of a goniometer, which is a special device to measure your range of motion in degrees. They're going to palpate the site, and they're going to perform a special test to check for laxity or looseness of your joint. If surgery is decided upon, there are a few options from which you and your surgeon can choose. You can have an autograft, which means that a tendon is going to be taken from your actual muscle and used to reconstruct your ACL, or an allograft, which means that a tendon from a cadaver will be taken and will be used to reconstruct your ACL. With autografts, there may be special precautions in physical therapy to ensure that you are not hurting the donor site. Depending on the type of graft used for your procedure, rehab time to return to sport or functional activity ranges from 9 to 12 months. You will be locked in a brace in extension for the first week following your reconstruction, but after that, the brace will be unlocked and removed for PT, or you might keep it on just in an unlocked position for PT. Your brace will most likely be used for the first 4 to 6 weeks following the surgery until a normal walking pattern is developed and a significant amount of range of motion is restored. The crutches will also most likely be given to you to assist in ambulation. Your first phase of rehab will focus on protecting your healing graft, reducing inflammation, restoring your range of motion. Your graft is the weakest during the first 6 to 8 weeks of rehab, so during this time, your physical therapist will be aiding you in prevention strategies to be careful not to damage your healing graft. Some exercises you're going to receive at this time are quad sets. This is going to be used to help initiate the first degrees of your hyperextension of your knee. So your physical therapist is going to instruct you not to push your leg into the table as this is going to cause contraction of the wrong muscle, and you're not going to be working on the muscle that actually needs to be contracted. So they're going to tell you to squeeze this muscle on the front of your leg. These quad sets are going to be progressive straight leg raises, which you're going to be in this position, and you're going to be raising the leg that you're rehabbing to meet the other leg. You don't have to go past your knee because then you're not receiving any more benefit from the exercise. Another exercise that will be used initially are long arc quads. They will be used at first from 90 to about 60 degrees, then from 90 to about 45 degrees. This is to reduce initial stress on your ACL, but by week 16, you're going to be back to full extension of your knee with this strengthening exercise. Other initial strengthening exercises you'll experience at this time are mini squats, total knee extension, and leg presses, which will be used to help enhance co-contraction of your quadriceps and hamstrings together. Total knee extension and leg presses are done on machines, but mini squats are done on the ground, and your physical therapist is going to instruct you not to bend your knees over your toes, and they're going to instruct you not to bend down too far to put more stress than needed on your ACL. Your therapist will also instruct you to use the bike to maintain your cardiovascular endurance and influence your range of motion. You will most likely be doing gait training too to help work on the normalization of your gait pattern, which is walking. Progression of your strengthening will focus to incorporate balance training into your rehabilitation. You will start working on a single leg stance at the knee that you're rehabbing for. Parameters of this exercise will be changed as you get better, so this is going to be either turning your head with this movement, changing the surface, or even closing your eyes. You're going to then start more progressive strengthening exercises such as single leg squats. You'll be doing sit to stands, which is just maybe sitting in a chair and then standing. You're going to be working on lunges, which is just kind of a moving squat. And another thing that you might do are bridges, which for this one you're on a table, you're laying down, you're going to lift your hips in the air. Okay, as far as cardiovascular endurance goes, you're going to be moving up to an elliptical or fast treadmill walking. After certain parameters for your range of motion and strength have been met, you're going to continue to progress to jogging, to low-level agility exercises, to jumping exercises, and then focus on cutting and pivoting to prepare you for your return to sport or functional activity that you're rehabbing for. I hope you enjoyed this video, and I hope that it helps in aiding your ACL reconstruction.